I was a classroom teacher for many years, and that comes with a lot of energy and enthusiasm in front of my students. And I found that as I was getting older, my energy level started to drop because of my weight. And when I noticed that my job was being impacted because I was not able to have all of the energy that I wanted to have in front of my students, that's when I knew that I needed to pursue some options. The death of my father left me with a small insurance check, enough to cover the surgery, and so I knew that this was my one opportunity to seek this out, and I pursued it immediately. I'm a debate coach, and that means that I do my research, and so I did everything I could to find out all the facts and details about what this might involve, and that research led me straight to the Bariatric Center of Kansas City and straight into a seminar where I learned more about the surgery directly from the doctors who would be performing the surgeries, and I was convinced right away that this was my future. It's tough to have a skinny person living inside an obese person's body with hopes and dreams and desires. And this surgery unlocked having enough energy to do everything that I've always wanted to do. And I have that now. I know my dad would be proud of me, and his gift unlocked those things for me. To anyone who might be considering bariatric surgery, it's a home run procedure, and it will change your life. My name is Josh Anderson, and I had a successful surgery at the Bariatric Center of Kansas City.
Hello, this is Dr. Bryce Hamilton from the Bariatric Center of Kansas City. Welcome to what we believe will be the beginning of the future you. During the next 20 minutes, you will learn about our comprehensive program, which is unique within the Midwest, misconceptions about obesity, the bariatric surgical options we provide, as well as what to expect before and after surgery. You will also meet our 3 highly skilled full-time bariatric surgeons who have the most operative experience in the region. That's me in the middle, Dr. Stan Hohen on the left, and Dr. Robert Aragon on the right. If you have questions as we progress through the presentation, please write them down. We will spend as much time as necessary during your office visit to get them answered. This presentation is just an introduction into all the wonderful things that bariatric surgery can provide for you. Unfortunately, obesity is reaching catastrophic proportions in the United States. You are not alone in the battle you are fighting. Most Americans suffer with some issue regarding their weight, and a full third suffer with obesity. The incidence of, or number of people with obesity, has more than doubled in recent years. We are dealing with what some consider an epidemic. When looking at preventable deaths within the U.S., you can see that obesity is second only to cigarette smoking, which leads in causes of death. A full fifth of deaths within the U.S. are related to obesity. This is not just an inconvenience, and it's certainly not a choice. It's a very serious medical condition that does not get the attention it deserves. Excess weight is not good for any organ system within the body and contributes to so many other medical conditions. What causes obesity? The disease that so many people suffer from? There is not one factor that is solely responsible for this deadly disease. We do know that there is a genetic component, which is absolutely made worse by the Western society we live in. Additionally, there are psychological issues that confound the problem even more, not a simple disease. One of the most frustrating things about obesity is that we really don't completely understand all the different factors that cause and contribute to obesity. Even though we don't know the exact etiology, we do know that it's not your fault. It isn't an issue of willpower. Pushing away from the dinner table and walking after dinner isn't the answer. This is an oversimplification of a very complex problem. There are many hormonal factors, which are too complex for this discussion, that are counteracting your weight loss efforts. The interaction between your stomach and your brain is not as simple as one might expect. It's not as simple as a calories in versus calories out, as we have heard time and time again. It's nearly impossible to defeat your body and its set point. As we try to lose weight, unfortunately, our body and brain aggressively defend itself, making it nearly impossible to do it by yourself. How do we classify excess weight? By calculating BMI. The higher the BMI, the more health issues and risks that are associated. A BMI of 30 to 39 is classified as obese, and a BMI over 40 is considered morbidly obese. If your BMI is 35 or above, then you are likely a candidate for help. As an individual's weight increases or BMI goes up, other medical problems, or what doctors like to call comorbidities, start to present. Heart disease, high cholesterol, sleep apnea, diabetes, high blood pressure, cancer, infertility, and bone and joint pain. The list is long of health problems associated with obesity. Obesity is a disease that affects us every minute of every day. Nothing is made better by excess weight. Not to mention the health tolls that obesity takes on individuals. Yet another vicious problem and cycle that obesity puts you through. When looking at one's overall health and considering obesity, not only do medical problems increase, but your risk of dying also goes up considerably right along with your BMI. If an individual suffers with obesity, there's only a 33% chance of living beyond the age of 65. We simply cannot accept this. So what are we doing about this ever-increasing problem? Well, as I'm sure all of you know, typical dietary means just don't work. I would argue that there's an even higher chance of failure with diet plans. They do not get at the root of the problem. An individual that suffers with obesity needs something to affect their physiology. No typical diet does anything to change your metabolism. Weight loss surgery does, however. You haven't failed. All the diets that you've been on are what has failed. Surgery provides you with a tool to fight the battle. Remember, this isn't an issue of willpower. You didn't choose this, and it's not your fault.
Hi, I'm Dr. Aragon, one of the surgeons at the Bariatric Center of Kansas City. Now that you've had a chance to learn a little about the basics behind obesity, I'd like to talk to you about the surgeries themselves and about our patients. If you're considering weight loss surgery and feel that you might be a candidate, please come and see us. We would love to partner with you in this surgical weight loss journey. Although we have noticed certain characteristics that are very common in our patients, if these don't quite describe you, that's okay. It doesn't mean that you won't qualify for surgery. We still invite you to come and see us. Our typical patients have often been overweight since childhood and have faced a lifetime of discrimination and frustration. Obesity is a lifelong progressive disease, and we understand that. Most of our patients have tried multiple diets and exercise programs and diet pills. However, their bodies just aren't responding the way they should. Most patients fall between the ages of 25 to 55 years old, and 3/4 are women. However, we don't set age limits on our patients, and we have certainly performed these operations in patients younger and older than this. The vast majority of our patients have a body mass index greater than 35 with an associated health condition, or a body mass index greater than 40 with or without a health condition. These are also the criteria that most insurance companies will use when deciding whether or not someone qualifies for bariatric surgery. Most of our patients have been considering surgery and researching it for approximately 2 years. Many of our patients finally decide to proceed with surgery when they've had a friend or family member that's undergone a surgery and has done great. Or they decide to go through with it when they've just been frustrated with the lack of results from all the other weight loss methods they've tried. Now I'd like to talk to you about the surgeries themselves, how we perform them, and how they work. The surgeries that we perform the most are the laparoscopic gastric bypass and laparoscopic gastric sleeve. We also perform a large number of revisional surgeries, which involves taking old operations that are not working well and converting them into the newer functional ones. All the surgeries are done laparoscopically through very small incisions on the abdominal wall using special instruments. This approach has many advantages, including less pain, faster recovery, and fewer wound complications like infection or hernias. It also allows us as a surgeon to have a better view of the anatomy. These laparoscopic weight loss surgeries are very safe and easy to undergo, requiring less than an hour to perform and only a one-night hospital stay, with return to normal activities in about a week. The surgeries have very minimal complication rates and are safer and more effective than the way weight loss surgeries were performed in the past. We are able to operate on all types of patients, including those with medically high-risk problems and patients that have undergone previous surgeries. Often patients will ask which surgery is right for me, and the reality is that they are both excellent options, and the best one is the right choice, which we will help you find. So let's talk about the gastric bypass. This surgery is performed using the laparoscopic incisions and ports. The specialized instruments and camera are then inserted into the abdominal cavity and the anatomy is visualized. The gastric bypass is performed by dividing the upper portion of the stomach using surgical staplers, thus creating a small gastric pouch. This allows for early fullness with very small amounts of food. In order for food to pass through, the small intestine is divided and then brought up and connected to the pouch. The lower intestine is then reconnected to itself, and this allows for passage of the digestive juices from the remnant stomach and the first portion of the intestine. The gastric bypass does not involve removal of any structures or organs. The surgery has excellent weight loss results because it will allow you to be full with small amounts of food. It also has a tremendous metabolic benefit because the first portion of the intestine is bypassed. The gastric bypass is considered the gold standard because it's been around the longest and it's what the other surgeries are compared to. On average, patients are able to lose approximately 70 to 80% of their excess weight within the first year. Because of the way the bypass works, it allows a lot of the hormones and chemicals that are secreted in obesity to be brought back into balance. Therefore, it's a great option for diabetic patients. It allows many diabetic patients to get off their medications and go into full remission within a short time after surgery. The bypass is also a great option for patients with severe reflux or very high BMIs. It does not cause malnutrition or diarrhea or too much weight loss. It's not a good option for patients who smoke because of the risk for ulcers. And it can have dumping syndrome if patients eat large amounts of sweets after surgery. Now let's talk about the laparoscopic gastric sleeve. In this surgery, once again, the laparoscopic incisions are used to place the ports and the special instruments and the camera. The anatomy is then visualized. The sleeve is created by dividing the stomach from top down and creating a thin vertical tube. In a normal stomach, the capacity for food can be very large, as much of the stomach is elastic and stretchable. Therefore, the sleeve works by removing this elastic, stretchable stomach. The stomach is then taken from about the size of a football to about the size of a banana. This allows for restriction with small meals. Patients feel full and their cravings are suppressed because much of that removed stomach is responsible for producing the hunger hormone ghrelin. About 75% of the stomach is removed permanently, but the intestine is not rerouted and food still follows the normal path of the GI tract. The sleeve has excellent weight loss results. It's easy to undergo and it's easy to live with. Patients on average are able to lose about 60 to 70% of their excess weight within the first year. It's a good option for the majority of patients, and especially patients who struggle with very strong cravings or mental hunger. In order to be successful after surgery, we want you to follow some basic dietary recommendations, which will help to teach you. We want you to drink about 64 ounces of water per day. This requires you having to sip throughout the day to avoid becoming thirsty because you're not going to be able to drink large amounts of water at once. We encourage patients to eat all their meals as small protein-centered meals, and this allows you to obtain approximately 60 to 70 grams of protein per day, which is the goal. Focusing on protein allows your body to stay in a fat-burning mode. We also recommend that all patients take bariatric-specific vitamins daily. This allows your body to receive optimal nutrients while you're focused on eating protein. Weight loss surgery has tremendous health benefits, and the majority of the diseases that are caused by obesity can be effectively resolved with weight loss surgery. It makes much more sense to treat the underlying cause of all these problems rather than to treat them individually. The effect that weight loss surgery has on diabetes is very powerful. Many patients are able to achieve remission and get completely off their medications within a short time after surgery. The effect is more than just because of weight loss. It treats the underlying cause by helping to reset many of those hormones and metabolic chemicals that are off balance in obesity. Weight loss surgery offers better treatment for diabetes than just medications alone. Weight loss surgery has been shown to increase lifespan and improves quality of life greatly. It gives you happiness, energy. Many of our patients tell us that it's the best decision they ever made, and they wish they would have done it 5 or 10 years ago. Try to imagine what it will be like to live life in a normal-sized body, to do your job with more energy, to shop for normal-sized clothes, to be able to ride an amusement park ride or sit in an airplane without getting a seatbelt extender. There's so many small victories along the way other than just the weight loss. Keeping up with your grandkids, tying your shoes, crossing your legs, getting rid of your medications or your CPAP machine. You have so much to look forward to.
This is Dr. Stan Hohen. Now that you've heard about many of the benefits of bariatric surgery, I'd like to talk to you about the many benefits of our program. What started out as a vision in 2001 became the leading center for bariatric surgery in the Midwest. We were the first program in the region to receive designation as a bariatric center of excellence. The office and surgical hospital are located in the same building, and we're both custom built specifically for our patients. We have a caring, passionate, comprehensive hand-picked group of staff that are here to help you every step of the way. Inside the practice and on our campus, we have our own psychologist, internal medicine and bariatric medicine, dietitians, physical therapists, and sleep medicine. The Bariatric Center of Kansas City is a boutique, bariatric-specific specialty hospital. This means that every room, device, piece of equipment, and staff was hand-chosen with weight loss surgery patients in mind. We have perfected the art of bariatric surgery by standardizing the operations, giving us predictable and reproducible outcomes. Our operating rooms were custom built for exactly what we do, providing a state-of-the-art, safe and efficient setting for our patients. Our surgeons are nationally recognized educators and frequently host surgeon and clinical training sessions at our facility. We've also received many distinctions of honor in Kansas City and beyond. Our campus is used to host educational seminars, support groups, cooking classes, exercise groups, clothing exchanges, and many other events. All providers are located on our small campus, leading to higher efficiency. Patients can see 3 to 4 clinicians in one short visit. We've performed over 12,000 successful weight loss operations in the last 15 years. Our results have consistently been in the top 10% in both outcomes and weight loss. We're a nationally recognized center of excellence, and we're the first practice in the region to achieve the designation in 2006. We've also been recertified at the highest level every year since. Our program and hospital participates and is in network with all major insurance plans. We are the regional center of excellence for all the major insurance companies and have been for well over a decade. We have an active social media presence that allows our past and prospective patients to stay connected with us and with each other. We also host a robust, closed online support group. What are your next steps? You'll receive a welcome email from our new patient advocate, which will include an electronic copy of the new patient packet. Once you fill that out in the privacy of your own home, send it back with a copy of your insurance card, and within a few days you'll receive a phone call to schedule your first office appointment where you can meet your case manager and your surgeon. We appreciate your interest in our program and look forward to taking the journey with you to better health and a better life. Thank you and welcome to our program.
Think about the future. What do you see? an emerging sense of confidence and optimism, a remarkable transformation, a life you've never known before. At the Bariatric Center of Kansas City, we believe futures are powerful. After all, we've seen 12,000 of them come to life.
The success of our patients is, I think, so much more beyond weight loss. We think so much more about how a person feels physically and emotionally. Do they function better? Do they wake up and have more energy? Do they want to approach the day and in a very excited way rather than maybe a tired way that they might have before? So for us, success is very broad. It goes well beyond the scale, and we're trying to help our patients achieve physical, emotional, and lifestyle improvements.
This isn't a lifestyle choice. It's not a weakness of the individual. It's a physiologic problem with the stomach-brain interaction, and surgery fixes that. So my goal is to give everybody a perfect operation so they can be the best person that they can be.
We've created an environment here where the weight loss surgery patient is the center of attention and they're number one. They walk into our lobby, they see this, beautiful lobby with lots of light. They see other patients that look just like them, and they have kind of found an oasis, right? That is tailored for them.
Hey, in under an hour we can change your life. And I know it seems like a massive journey to you, but I can see the future because we've been doing it forever, and we've done over 12,000 cases here. And I know what you're going to be a year from now if you choose to go through this. It's not as hard to get there as you think. We'll help you do it. And if they'll just be brave enough to show up and spend an hour of their lives with us, we can change a life, and it's a beautiful thing.
The future you is out there. And the Bariatric Center of Kansas City is here to help you find it. Discover how